And it's my great pleasure to introduce the very first speaker of the morning. And Daniel Garros, originally from Brazil, for over 20 plus years now in Canada, in Edmonton, and is a pediatric intensivist and really has been interested in ethics and pediatric palliative care for many, many years, and as such has been invited to our scientific committee. And he's going to talk this morning, and when I asked him what can I share, he said, of course you are excited about soccer. As a Brazilian, your kids, everyone is really big into this, so you can really, really feel the excitement we have here in Italy. And we had COVID for the last 2 years. Some of you may have noticed, and Daniel is going to tell us about the impact of COVID-19 restricted family presence. So this idea that children are for weeks at times without anyone visiting them, listening to them. So with no further ado, the clicker is here.
All right, thank you.
Daniel.
Thank you. Thank you, Dr. Fritjof. It's a great honor to be here, and I'll do what everybody is dying to do, is to take the mask away. This Congress has a special place in my heart. And to be the first Congress that I come in person to talk, it is a great privilege. And I thank you, organizing committee, the executive committee, and the Maruzza Foundation for inviting me to speak here again today. I do have another thing in common with Rome. I come from a place where the last king of Rome came from. Whoever is older in the audience will remember the last king of Rome. His name was, does anybody remember? Paulo Roberto Falcão. Remember? Yes. Paulo Roberto Falcão, you can Google, is one of the biggest soccer players ever in Brazilian history. And he left my team in Brazil to come to play for Rome. That was really hard. And he became what was known after that as the King of Rome. So I went to a bar one day here in Rome, last time I was here, and there was his picture on the wall, huge. So, no talk about COVID throughout this conference. This is kind of almost unheard of over the last 2 years. So I asked the executive committee, please let me talk about COVID. So much I was dying to talk about COVID. But no, I just want to talk about something else. I want to say that this was the hardest time for our families. And I could not escape from the responsibility of bringing this up. And you will understand why at the end. So let's see if I can get this going. So thank you for the support to come here. And these are the partnerships that we have in our studies that we have done over the years on moral distress and now on COVID. So we review the rationale for visitation restriction. And I don't like the word visitation restriction. I like the word, as I put it over there, a restrictive presence of the families. And the reason being, families are never visitors. We'll discuss some repercussions of these measures. We'll look at some studies that we have done in Canada, and you guys will be the first audience ever to learn about our studies. One is submitted for publication now, and the other two will be presented in the World Conference of Pediatric Critical Care, and we're writing up their final drafts. And then we'll talk about what the families told us about this period. And then at the end, I would say, would we listen to them this time around? So the problem with COVID is very well known and started big time here in Italy after China. and a lot of people got killed. This healthcare professionals got killed by COVID. This is a WHO site. They have even a report on it. Then this is in the US, nearly 600 healthcare professionals died. And this is in Brazil, where they did a national mourning day where the healthcare professionals went with crosses to the streets to commemorate the death of their comrades. And what happened with COVID is that all our values, and you can see Declaration of Patient Values on every single hospital in our country there in Canada. We live our values, our mission, and all the things about how important it is to have the family-centered care and everything. What happened? Gone. Gone. We didn't care about families anymore. We forgot about them. We thought about us. One director of one of the huge pediatric hospitals in the States said one time in the beginning of the pandemic, we want to look after our people and not the families. No pediatric families were really care about, and we'll see that. And this is an adult study that show that if you don't allow, and this happened during COVID, the adult families in the ICU anymore, the ICU increased by 2.9 days, and the time for the first care limitation to be discussed and implemented was delayed. And you can see on the graph, pre-policy, post-policy, after restriction, 2 plus 2 more days to reach limitation. And this is a big study in France, adults as well. I just want to highlight what is red, that comparing patients, families, adults with COVID and that had visitation restriction, and patients prior to COVID that they had ARDS, that over telephone interviews after the fact, psychology assessment, patients that have groups visited versus non-visitation, more common PTSD, anxiety and depression on the families as a factor of two times more odds ratio for PTSD on those families who had a restriction for visitation in the adult ICUs. We should have learned this. This is not COVID. This is 2003 SARS epidemic. A nice study done in Toronto at Sick Kids, looking at families and looking at kids. And they said, the kids said, that we were punished even though I didn't do anything. They interviewed children. We're doing that too in our study right now. And it was like being in jail and you cannot get out. This is like a 7 and 8-year-old told after being interviewed. So we knew that already in 2003. And why did we do this again? And this is from UK and the BMJ. Children are perversely suffering the benefit for adults. And the reverse Titanic phenomenon. Women and children last, not first. Remember the Titanic is women and children first. Now women and children were last. Women were alone giving birth, and children were alone in many ICUs in the world. And there was a bias against children in favor of adults. And you would say, Daniel, are you crazy? This is the way that should have been. This is the way that we could do at that time. There was no other choice. Well, it is a difficult balance. You have to look at the patient-centered care versus a public-centered care or a policy. So in normal conditions, the pendulum goes towards patient-centered care. And then in emergency conditions, it can be towards more public-centered care. But the problem is the basic ethic approach of this was the utilitarian approach, which was going to be conserve the medical resource that prevent the iatrogenic spread of infection and protect the healthcare professionals and other patients. That was the idea initially. But we learned right away that this was not the way that needed to be. And then one ethical principle that we didn't really pay much attention to was the ethical principle of proportionality. So what it does is a restriction on individual liberties incurred by measures do not exceed what is needed to respond to a community's assessment risk. So you assess the community risk, and then it requires a response that is greater to the severity of the disaster. In the beginning, yes, but right away we learned that we did have PPEs. Right away we learned that did not need to ask the Ford company and the Fiat company to build ventilators. We did have ventilators. So we learned very quickly, and we never change our minds. And still today, we're restricting family presence in some hospitals. So the question is, are we doing more harm that is needed? And for sure, this was the case. So this is the beginning of the pandemic, and the New York Times wrote that quote there. Of all the ways the coronavirus pandemic has undermined the conventions of normal life, perhaps none is as cruel as the separation of seriously ill patients and their loved ones, now mandated at hospitals around the world. And the figure on the right is on the beginning of the pandemic in Brazil. A friend of mine sent me this picture of a priest doing a last rites on a baby that was going for a significant operation. The families, the doctors and the group said, you cannot be in the hospital, you cannot be here, you cannot do any ceremony, you cannot bring the priest, nothing. And the family said, no, we want to bring the priest on our phones. And the family ran out of the hospital. They found the first church that they could find, got the priest on the phone, and here's the family around, and they did that. And we published that in CMAJ in the blog there. So this was the beginning of it. Patients dying alone, the hardest part. And you probably remember the story of this man that climbed outside the hospital 3 floors to see his mother dying in the ICU. He couldn't be away from his mom, so he decided to climb the walls of the hospital. So this was predicted. It did not need to be that way, and we published this paper right in the beginning of the pandemic, a practical approach to hospital visitation, and we said, and we submit this to 3 or 4 big journals, and they all rejected. So finally, a nursing journal, the critical care, American Critical Care Journal decided to publish. And then afterwards, people kept calling us to give them the summary of the paper. And what we talk about is that we needed to do a staged response according to the environment, according to the epidemiology. This blind response, closing everything, was not appropriate. And we published this very early at the time of the pandemic. So then we decided to look at the presence of families in the ICU, and we decided as a group in Canada to study this. We did a project, it's called Impact of Restricted Family Presence. We look at health administrators, we look at health professionals, and then we interview and survey patients and families. So I don't have the time to go over this, but the administrators is an interesting story. When we interviewed the administrators, and you understand why the commode is there, we found that the administrators, 29% designated caregivers were not allowed to leave the room. In the pediatric world, 67% had severe restrictions on mobility according to the administrator's practice policy that they wrote, and 80% indicated that the designated caregiver could not leave the hospital. So what were the problems that we saw? We had to put commodes in patient rooms. We are resuscitating, there's a story of one of the hospitals that in our survey, they were resuscitating a patient where the parents were actually using the commode inside the room beside the child behind the curtains. There was nicotine withdrawal in another hospital. The staff was aggressively treated, and we had to look for nicotine patch to give to families because they couldn't go out for a smoke. Patients were sleeping in chairs, the administrators were telling us. Some people are asking to sleep on the floors, they were not allowed. And then the hospitals spending nursing hours, one of the toughest salaries in the hospital, for them to bring Uber Eat or pick up meals at the hospital doors for families. Impact on clinicians, we had this study, and I could show to you today, but I don't have the time. But we had 17 out of the 19 ICUs, and the patients responded, and the ICUs, physicians, nurses responded. And what they reported to us is that 66% felt that there was an incongruence between these policies and practice and the PICU values. 71% felt their opinions were not valued with implementing the policy, so the policy came from top down. Nobody asked what the people in front thought. And then the problem is that the people in front, the frontline people, have to implement the policies and explain to the families. The hospital did not explain. They didn't do anything. Some of them put on the media, but didn't talk to families. And 57% disagree that their experience was mainly positive. But interesting enough, and we were quite curious, that 52%, especially nurses, felt that it was much better to work this way without the families. Yeah, interesting. I'll leave that for you to think about. We did an impact on event scale, and this level of event scale is considered very high for already referral to psychological support. So this is what the healthcare professionals felt, and the main thing for them was concern about the impact on family, of course, and the non-family center end-of-life situation that they had to live at 29%, so 30% led to this impact. We did a moral distress thermometer study, and we found around 5 is our average there, and that's considered a moderate degree of moral distress, and obviously is balanced out between people that felt that was good to have families, but people felt that was bad, very high levels of moral distress, so you can see the curve. And the strongest predictor of moral distress was the perception of a differential impact of these policies on different families. And then we did the change in stress as a result of the restrictive policy and practice, and you see that the two most important things was that there was an increase or a significant increase as a result of this policy in terms of general stress for the healthcare professionals. The other interesting thing, the increased workload for the nurses and all the people that work in the ICU were those last 3 bars: comforting, entertaining patients, updating and supporting non-present family. They had to do a lot of work, and negotiating exceptions. Look at that, negotiating exceptions to the rules. This is what made people work more. And then we had to listen to the families. I don't like this picture because this picture is rounds outside the family room in the ICU. That should never happen. People love that, especially when they carry 300 computers at them and nobody can enter the room because there's so many computers. Well, our norm before was families always present. Either we go into the room or the families come out. 80% in the survey in Canada showed that families were not allowed to participate in the morning rounds, and this only changed during the second wave and the third wave, where the families went back in. And so we did this study, and I don't have the time to show you, but I had some videos from UK and from Brazil, the parents complaining of the impact of these restrictions. And this picture on the top of the Brazilian video, where families were not allowed at all, not even one person. And in fact, if the child died in Brazil, in the first 2 waves, the parents could not hug their dead children because they were in bags, plastic bags, and they were not able to touch them, just touching the plastic bags. Was this Ebola? This was on BBC. So it was incredible what we saw. And the family impact on restricted visitation, and this is the family's response. We had 250 families responding to our survey in Canada. I have more than 100 pages of families' testimonies on how crucial and how painful this was to them. And we just said 75% were very negative experience, 25% were neutral, or some families felt that this was a good experience for considering what was going on. But the hardest part was the lack of support. 45% said that. Limited, unmet emotional support, missing a person, lack of support led to impaired medical care, decision-making, communication. And the top situation, we call the top situation when all the factors we measure were so heavy that we put together as the weighted top situation. 13 cases when the child died, the parents said being alone, wished for support, and it was a traumatic experience. And when we did a non-weighted top, when the child worsened, they wanted support and 89% couldn't have it, and was so traumatic for 87%. So this is just numbers. I rather see what the family said to us in this more than 100 pages of documents. And what is most interesting is, as you know very well, the children were not sick. The children did not have COVID. Only 8.6% in our survey had positive COVID in the children. And the graphic even showed the suspicion of COVID, only 14%. But they were now paying the price for these policies. So when we ask, who informed you of the decisions, and this is a word statistics, so you put all the words together and see what the words, the highest that comes out, and the nurse was the top that informed the restrictions. So instead of being administrators, instead of being a policy that was publicized throughout the hospital, the nurses had to, at the bedside, tell the families, you cannot be here, get your husband out, or he's in the parking lot waving, but he cannot come here. And they were told verbally, and informed that was mainly the staff at the hospital that did that. And the nurses were very good, offering a break to get coffee, food, etc. They took care of me as much as they care for my daughter, one of the mothers said. And we were happy that 62% of families still consider themselves part of the team, or both team and visitor. But this was a great work from the nurses to help the families, and that was very evident in our study. What was the hardest part? And you can see the big word, support, lack of support. This was like throughout our survey was the biggest word that came up. And deprivation of human dignity. These are different, every bullet is a different mom or a different dad or person saying something. I did not take a break or place to go for some mental relief. The lounges were closed, and same with the dining area, and food is not allowed to be brought into the PICU. And then the other thing is that the other mom said, I would not cry in front of my son, so I would cry in the elevator or in the bathroom. I had strangers trying to comfort me from a distance in the hallways. It was so hard. They had even a shower. We had parents reporting that they went 2 weeks without a single shower or a bed to sleep on, just chairs, and never been treated so poorly in my life. I asked to be allowed to sit on the floor and was told no. These were like the deprivation of human dignity that we saw in the families. And when the families were facing death, was even worse. So this restriction caused her to miss out on time with her daddy in her final weeks here on earth. I cannot put into words what a huge deal this is. Not being able to have my husband with us most of the time caused additional emotional distress for me. I'm certain that if my husband could have been there as much as we want him to be, I would have been able to do a better mommy to her during that time. And then also very hard on the twin. Another mom told us. The other one said there's no way to pick and choose who gets to say goodbye when a patient is going to pass on. And what was really sad is that the nurses, administrators, and the hospital administrators will only allow end-of-life situations to allow both parents to be there. in pediatrics, in adults sometimes as well. So who knows when the child is going to die? Is that today? Is that tomorrow? Is that a week from now? So how many hours before you allow then the father to come in? We had a family in my hospital where the father was blocked at the entrance while his child died, had the last breath when we are withdrawing life-sustaining treatment. And we're waiting and waiting and waiting, and then we couldn't even withdraw anymore because the child was dying already on the ventilator. And the father was blocked at the door after traveling more than 150 kilometers to come in because the police, the security guard would not let in until we call, and we had called before. So all these situations, one after another, how do you handle this? And one mother said, the people that made these rules clearly have never been through anything so traumatic with their children. My husband and I needed each other's support, and we could not have it. So a kid with a brain diagnosis, I still have PTSD from that day, not being able to be together as a family and lean on each other. One parent receiving the news, not able to share, deciding about chemotherapy alone with the other parent on the phone. So this was really bad. The bad and the ugly, and these are the things that the mother said, this frustrated, sad, parents also said, fathers, deflated, awful, panic, unsupported, helpless. I even put in Italian for you, because I think in Italian the words sound better. This was really sad. The process of doing this was so unclear, nobody knew what to do. At least there was some good weight reduction program. So one mother said, I lost 10 pounds while in hospital because of lack of food, while breastfeeding my baby every couple of hours. Not only one said that lost weight like that. So how do we fix this? To finish off, I'm going to show you what the parents said. These are adults. Adults still are discussing, this is papers, what to do. And they still haven't opened their ICUs. And they keep saying telehealth and blah, 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 and phone. And nobody says, bring them back in, please. This is what the adults are saying. But the families said this to us. There's no evidence for this stupid thing. There is no evidence that this makes any difference. Transmission of COVID in hospital was 1.5%, 1%. There's no need for this. I'll allow always 2 caregivers and siblings if admission prolongs more than 2 or 3 days for siblings. Make PPE and everything and supervision available. Provide comfort, shower, food, water, sleeping conditions. Let the patients go outside, families go outside and come back in. Be compassionate, be human. Rapid test if surgeries happen. Let older children decide who they want beyond their parents. Ask the teenagers, ask the kids who they want. This is families saying to us, making the process clear, evidence-based, and communicated well. Know the reasons behind rules and exceptions. In involvement and feedback of clinicians and families to discuss the rules, not just dictated from the top down. This is what the family said. Invite parents to rounds, even if it is via Zoom. No worries, just do it. Give access to working Wi-Fi, no crappy Wi-Fi in hospitals that never work. Never allow one person when there's bad news, new diagnosis, surgery consent, surgery day. To die alone is not okay. We don't know when it's going to happen. This is what families were telling us. And a mother of a child said this, and I think I'll finish with this sentence for you to put in your mind. It was sickening. Never do this to parents again. Thank you very much.